Welcome to Empowered Health. I'm Erica Zink, the health coach, and I will be your guide through this orientation video. As a precision medicine clinic, we do things a little bit differently here, and so the goal of this video is to guide you through what those differences are to ensure you feel empowered to get the most out of your membership. The way that we approach your care is through what we call the Empowered Method. This is a four-part cyclical process that starts with your first visit with your medical practitioner. This is going to be a 90-minute appointment that will give them plenty of time to go through your medical history, your lifestyle history, as well as to understand what your goals are in relation to your health. Based off of that discussion, they will know what data they want you to gather before they see you next. And so they will send you out to gather that information, whether it's through lab work or tracking any habits or patterns that you currently have. And so once you've gathered that information, you'll come back for a follow-up appointment that will be 60 minutes long, and that will give them plenty of time to discuss your health action plan, which is going to be a set of recommendations that are personalized to your wellness based off of your medical situation as well as lifestyle behaviors. The 60 minutes will give them plenty of time to make sure you understand why they're making the recommendations that they are, as well as help you narrow the focus on where you want to start with the suggestions within your health action plan. After that visit, you will meet with me to do a coaching review, which will give you another chance to review your health action plan, to discuss any concerns that you have. And that conversation will be around accountability, any extra support that you need, or if there's any extra education you need before you get started. And that visit will be anywhere from 30 to 60 minutes long. This process can repeat as many times as you need it to throughout the year. Some people do it annually. Some people need to do it multiple times a year. It really just depends on what changes for you with your health and how often you want to update that health action plan. Throughout the year, it might look something like this. These are those first four appointments that I talked about, including today's orientation video. Throughout the year, it might be something like this. During your follow-up appointment, your medical practitioner will let you know what they suggest for follow-up appointments. But it's usually something around a 3, 6, and 9-month follow-up with labs, but they'll let you know if it's going to be more or if it's going to be less. It really just depends on what's being tracked and how often you all are looking for changes. Around 6 months after your first appointment with them, I will give you a call to check in to see how you're doing with your health action plan, if anything's changed, or if there's any other support you need from the clinic. At the end of the year, or after the end of the year, you'll come back and do an annual physical, another follow-up, and then you'll have another coaching review, and these will repeat every year. Just a few reminders regarding that first appointment with your medical practitioner. Be sure to go in and complete all questionnaires in the portal. You can do this by logging into the portal, and you'll have this menu off to the right-hand side, and just click on questionnaires. It'll pull up all the questionnaires that are available for you. So just click that green start button for each, fill out the information, and hit submit when done. You can also enter in your current medications or supplements that you're taking. You can do that by clicking either of these menu options over here. This will allow them to know any adjustments they need to make at your follow-up, but you can also bring these bottles in with you to your first appointment if you would like them to assess any of those that you're currently taking. And then if you see any red exclamation points like these little guys right here, this just means that that area needs attention. So be sure to fill out the information within those sections. And the goal would be to have this done within at least 24 hours before your first appointment. The labs that they will submit after your first appointment are going to be fasting, and that'll be the same thing for any annual labs after that. And so this means no food or beverage for 10 to 12 hours. You can drink water, black coffee, or even some tea if there's nothing in it, and you may be asked to give a urine sample. The subsequent labs throughout the year may or may not be fasting. Your practitioner will let you know what they recommend when they submit those labs. We send our labs to Interpath, so if you need us to send them to a different lab, please let us know. And if you have concerns about whether your insurance will cover the cost of the labs or if you don't have insurance, we do have an option for a reduced cost cash pay through Avexia Diagnostics. So if that's something you're interested in, just let us know. We are primary care, so what this means is we are now your family doctor. So if you have any concerns with your health, something comes up unexpectedly, whether that's an urgent health concern or you're just wanting some follow-up visits to see where you're at with your healthcare, you can schedule those appointments with the clinic, and that is included in your membership. It's no extra cost. We also do routine health screenings, and the We offer the convenience of telehealth and phone visits to make sure that you are able to continue to get the healthcare that you need and working with you within your schedule. We also do medication prescribing. We just want to let you know that it can take up to 48 hours to process those, and you can submit those refill requests through the patient portal. We do not, however, administer vaccines through the clinic, but if you do find yourself in a situation where you need one prescribed, we can do the prescribing for you. So if that comes up, just let us know and we can walk you through the process. You can also schedule appointments through the portal by clicking the My Appointments menu option. This will take you to a window where you can choose your provider and then pick a day or time that works best for your schedule. You can also communicate directly with your provider through the portal by clicking here on Secure Messages. This allows you to send updates or ask questions directly with your medical practitioner. And the convenience there is you can also send messages regarding any new symptoms or something that comes up to find out if you even need to come in for an appointment. And so they'll let you know if they want to get you in the schedule, or maybe they have some suggestions that you can try first to see if that will help before scheduling an appointment. Just setting expectations around responses through the portal. If it is an urgent matter, you will get a response within 24 hours, 7 days a week. So the nice thing there, even over the weekend, after hours, if you send a portal message, you will have that 24 hours, 7 days a week response time. And the thing to remember there is if you do have something urgent come up, we encourage you to send messages through the portal versus calling and leaving a voicemail, because if you leave a voicemail, it's going to be the next business day before you get a response versus that 24-hour response time. If it's a non-urgent question or matter through the portal, your responses, we will respond within about 48 hours business days. We're usually faster than that, but we just like to set that expectation so that we're all on the same page. Speaking of clinic hours, we just want to share those with you because they do fluctuate throughout the week. We always open at 9 a.m. Monday through Friday, but we close at 6 Monday and Tuesday. We close at 5 Wednesday and Thursday, and we're only open until 3 on Friday. And just reminding you that we have a nice convenient location in Richland in the Parkway on the corner of George Washington Way and Knight Street. And we also want to make sure that you are getting our emails in your inbox. So let us know if that's not happening. The reason for that is we do send you a message through the portal, you'll get an email that there's a message there. If we have it to make any adjustments to our business hours, we will let you know what those are through an email. So just be sure you're getting those. The other thing we want to let you know is to not hesitate to ask us if you have any concerns. If you're uncertain about what to do next, or you thought you should have heard from us, send us a message. If you feel like you're not progressing at a pace or in a direction that you thought you would be, let us know. That lets us know if we need to make adjustments to your health action plan, or if maybe we need to do a better job of explaining why we're waiting to see what's going to happen next. But do not hesitate to send us your concerns. We want to make sure you feel in control of your wellness. Once again, we just want to welcome you to Empowered Health. We are so happy that you are here, and we can't wait to get started to help you on your wellness journey. And if you have any questions before you visit with your practitioner, don't hesitate to send us a message. We look forward to working with you and seeing you soon. Thanks for watching.